Hi, my name is Ben Rohr, and today I will be comparing health factors between Montenegro and the United States. Just to start off, a little background on the country of Montenegro. It is relatively small, both in geographic size and in population size. It is also a relatively new state, considering that it just gained independence in 2006. It is located just across the Adriatic Sea to the east of Italy. For a population health factor, I chose to analyze the prevalence of tobacco smoking among adults in each of these countries. And this number is about double the United States number in Montenegro, and this could be attributed to the factor or to reasons including cigarettes are relatively cheap in Montenegro, and there is not really a stigma attached to smoking. It's kind of part of the Balkan Peninsula's heritage. It's very popular there over the last 100 or so years. Whereas in the United States, there is a stigma attached to smoking, and many people are aware of the negative health effects that come along with the habit. For a healthcare spending factor, I chose to analyze the total healthcare spending per capita between these two countries. In the United States, we actually have the highest total healthcare spending per capita number among any country in the world. And the total healthcare spending per capita in Montenegro is about only 1/10 of that of the United States. This could be attributed to the fact that in the United States, technological advances in medicine are very popular, and these cost a lot of money. Technology and equipment in hospitals and in doctors' offices can be tens of thousands of dollars, if not millions. For healthcare systems, I could not really find a factor. The World Health Organization does not have much data on incidence of diseases or conditions in regards to Montenegro, as well as the mortality rates associated with these conditions or illnesses. I found an article on the World Health Organization website explaining that Montenegro does not put out much data in regards to these two things. It was kind of frustrating, but having the article, it kind of reassured me that there wasn't much data out there. For a public and health prevention factor, I chose to analyze the percentage of children who receive all recommended vaccinations between the two countries. In the United States, vaccinations are very common and have been for decades, so the percentage of children that have received all their vaccinations is about 90%. This was expected. Whereas in Montenegro, only about 68% of children receive all of their vaccinations. And what it comes down to is there is a pro-rich inequality and a pro-urban inequality when it comes to vaccinations in Montenegro. Essentially, this means that both rural communities and lower socioeconomic communities have a bit of a stigma towards vaccinations. They don't completely trust it. They're a little bit hesitant. Again, this could be because Montenegro is such a young country that is still developing as their own state. These trends could change over time. For a physical environment factor, I chose to analyze the percentage of children exposed to secondhand smoke, specifically between the ages of 13 to 15, and this would be in the home. These numbers were very different between the two countries, with the United States only having 12% of these children exposed to secondhand smoke at home, again because there is such a strong negative stigma surrounding smoking in the country. Whereas in Montenegro, the percentage of 76.8, it kind of went along with the high rate of adult smokers in the country. These people, because it is such a part of the culture, aren't as hesitant as U.S. citizens to not smoke around children, family members, coworkers, and so on. For the access to care factor, I chose to analyze uninsured adults, and that would be anyone between the ages of 18 and 64. In Montenegro, this rate is at 0 because the entire population falls under universal health care, which is paid for through income tax and self-employment taxes. In the United States, the rate is 8.8% of the entire population is uninsured still, and that's even after things such as the Affordable Care Act And this would be because certain people who are unemployed still would struggle to afford such health care. For social and economic environment factor, I chose to analyze the unemployment rate in the two countries. In Montenegro, this rate was 16.06%, whereas in the United States, it was only 3.7%. The rate in the United States could be attributed to the fact that we are climbing out of a recession that happened about 10 years ago, so the economy is doing fairly well, as seen by the unemployment rate, which continues to drop each month over the last few years. In Montenegro, which is still a young developing country, as I've said before, they are in a bit of a recession. And another factor that plays into their high unemployment rate is that there are a lot more young people going to college. And these young people, after they get their degree, come out and start looking for jobs. So the competition has increased, which has left a lot of young adults unemployed in the country. Key takeaways from the factors mentioned above include that newly independent Montenegro has very high unemployment rates and very low health spending costs, both kind of because it is a new country, as I've said before. The unhealthy traditions in Montenegro, such as smoking and a lack of childhood vaccination, lead to unhealthy and unfortunate health outcomes. And finally, the small size of Montenegro attributes to the fact that they are able to utilize universal health care, whereas this would be a bit more difficult to do in the United States. Conclusions from these takeaways are that population size can sort of dictate what sort of healthcare a nation utilizes, or at least can influence that. The age of a country, or how long it has kind of been developing as its own independent state, can dictate how much healthcare spending per capita a country can contribute. Basically, that is dependent on the economy of that specific country. And historical traditions and trends can affect health outcomes for the population of a country, as seen by the higher rate of lung cancer patients in Montenegro when compared to the United States. So, in conclusion, Montenegro is a very young state, and for this reason,